Okay, everyone, let's get started. So welcome to our seminar meeting. We wanted to share this because one of my colleagues was asking me about this, so thank you, Natalie. We're talking today about how to stay healthy this spring. I'm Dr. Julie Huang. I'm a naturopathic doctor here at Aurum Medicine and Wellness Clinic, and today we're being joined by my colleagues, and I would say much better experts on the topic. So Dr. Vivian Kwan and Dr. Tanya Tabar. And so we'll all three be here available for you to ask your questions after the chat. And we wanted to start by giving you, some quick, some tips and some insight into what we're thinking and why we would want to put on a talk like this. I mean, so why don't we get started with that? And then I'll introduce each one of my colleagues as they speak. So why would someone want to stay healthy? I think that's, it's a seemingly obvious question to ask, but we want to address this because I think that knowing why you're doing something really helps motivate action. And so a lot of the common answers we hear are, to live longer, maybe you want to thrive, not survive, that kind of idea, to have more energy. And one that's really important to me is that it actually makes a lot of economic sense to stay healthy in terms of finances. When one is ill, you have to take a lot of time off work. You may have to, pay for medications and pay for treatments. And so staying healthy, people talk about an ounce of prevention is worth a pound of cure or something like that. And so that's like a really common thing. And we're not talking so much about just prevention, but really about reducing the risk and what it means to be well. So I think that saving money is one that motivates me a lot. Other reasons why you might want to stay healthy, maybe you want to look better, maybe you want to feel better emotionally and mentally. And I think a really big reason nowadays is to think about, well, who am I doing this for? A lot of times we'll see patients, and I had a lot of patients who maybe are saying, hey, I want to be healthy because I want to be able to play with my grandkids, and I don't really, I want to be able to lift them up. And that's the kind of thing that can be very motivating. So for your friends and family and community, and especially in this time, that was, I think, an underlying motivation for a lot of us, and why a lot of you might be joining us. And many of you might say that you want to avoid getting COVID-19. So I want to address that real quick before we get into staying healthy and what that looks like. But to be frank, we aren't going to teach that to you today. The basics of avoiding COVID-19, as many of you have heard, are really to avoid getting it and spreading it using adherence to public health guidelines. And so that means physical distancing, but what that really means is staying at home and minimizing the chance of both exposure and transmission. And so that's really all we can say about that, is listen to your public health officials and let's try to minimize and slow the risk of the rate of infection. But we think that staying healthy actually is something that we can do to support the hospitals and the medical system in terms of their burden, like what they're experiencing right now, and what's upcoming could be something that is too much for the healthcare system. And so by staying healthy and keeping ourselves and our loved ones out of the emergency room, that's our way of contributing. And, many of you know and may not know, but many of you may be aware that a high number of admissions to hospital emergency rooms are due to cardiovascular incidents like heart attacks and strokes, and infections like colds and flus. And a lot of times there are also folks who are coming in with injury, of course, and we value their life-saving efforts. But if we can minimize the actual need to go into emergency room, that's kind of what we were thinking is, why don't we do what we're good at? We're naturopathic doctors. We're here to teach the principles of healthy living. So why don't we do that? And so we believe that every single one of us can contribute to what we're trying to do as a community, both locally and globally. So in order to do that, our Aurum providers have put together a rich set of guidelines for you. And they're really to help you, stay healthy. And we're going to address a lot of the common questions that we're getting about nutrition, about herbs, about lifestyle things. So we hope that you find it helpful. And I wanted to tell you too that we're going to be producing a handout for you after this event, and we'll be able to email that to you and have it available on our website. So don't worry about taking rapid notes. Really just, we're grateful that you're able to be here with us and enjoy it. I want to introduce Dr. Vivian Kwan. She is, can you wave, Vivian? Maybe unmute yourself. Like, do I have to unmute you? I think you're on. Okay, I'm going to unmute you. So there you go.
Hi.
Hi. Okay, so Dr. Vivian Kwan actually runs our IV intravenous vitamin therapy clinic at Aurum, and is a functional medicine provider. So really is an expert in nutrition and functional medicine and the globality of the human condition. So she really focuses on chronic infections, and that is huge for reducing risk right now and staying healthy. So we're really fortunate that she works with us. I'm very grateful. Let's be honest. It's so fun. It's such a joy. So she's going to talk a little bit about nutrient deficiencies and more, and the foundations of a healthy immune system. So I'm gonna let you take it away, Viv.
Thanks, Julie, for the great introduction, and hi, everyone. Thanks for joining. So the immune system in 10 minutes. I'm gonna try to, stick to a few points that are important, and I think something that we can all do little things to modify. And I love the immune system, and I keep studying it and I keep working on it because I believe it's the foundation of good health in every matter, not just in cold and flu prevention, but a good immune system is necessary for like anything down from autoimmune disease to cardiovascular disease to cancer, right? So all these things are super important, and having a balanced immune system and an immune system that doesn't get too inflamed is super important. So in terms of like knowing, do you think you have a good immune system? How do you know? So some things I ask patients usually and how to gauge is like, do you get sick more than 1 to 2 times a year? And if you're sick, are you sick for like a long time? So are you sick beyond a week? I get some people that come in like, oh, I've been sick for 3 weeks and I can't get better or something like that. And also, I have the other population that don't actually ever get sick symptoms. There's no fevers, there's no coughs or anything, but they constantly feel like they're run down, like they're very tired and not feeling well. And that is also a sign of sickness, but the immune system is actually not even strong enough to kind of mount a response. So you have to think about that too. And then anything else, like when we consider, what are the risk factors in ending up in hospitals and not being able to fight infections well, like any cardiovascular disease, any diabetes, all of that can be like an underlying, ooh, should we look and see what's going on? Something's imbalanced and we want to help balance that out. So before we get into anything like supplement related, you have to kind of evaluate your foundations. And I know we hear it over and over again. I hear it over and over again, and I say it over and over again, but like, a good sleep, deep, restful sleep. And I'm talking 7 to 8 hours think about it. Do you feel refreshed when you wake up? Are you sleeping through the night? Are you having trouble falling asleep? These are things that you want to think about and evaluate, and make sure, like, you're sleeping in a nice, restful space. It's not cluttered and you feel good. And the other thing is hydration. We want to make sure we're drinking enough water. I used to not drink water at all. And I've now transitioned to, like, I try to get 2 liters in a day, and I feel fantastic when I do. And when I don't feel good. So water itself can make you feel more energy. It helps your immune system, and you just feel amazing after. Good for your skin too. That's important. And the other thing is nutrition. So nutrition is a huge part of it. Like, you cannot supplement a bad diet, right? So you have to kind of evaluate what you're eating. And for nutrition, I would break it down into like 3 components, right? We have our macronutrients, which are our carbohydrates, proteins, and fats, right? And you want to make sure you're getting enough protein. Protein is the building block of everything, of our immune system, of our neurotransmitters, everything down like to, muscle building, to mood, to immune function. We all need like those proteins for building blocks. So making sure you're getting adequate amount of like a good protein is important. And good complex carbohydrates, and then healthy fats in your diet. The other part is micronutrients. So these are the parts that we tend to supplement. So things like vitamin C, vitamin A. I'm going to touch on these a little bit later, but these come from food as well. So you want your variety of food to be healthy in that. And where do we find most of those things? A lot of those things in like fruits and vegetables, let's say. And the third component are phytonutrients. So phytonutrients come from plants, and they're the colorful part of plants. So there's all the different colors, right? We have basically every color from the rainbow. I'm going to say that's what I usually encourage, eat from the rainbow, because every single color of the phytonutrient has its own property. So they have anti-inflammatory effects, they have immune modulating effects, they have anti-cancer, like they're just so protective. And we want to make sure we're getting sufficient amount in our diet. So, and different ones, right? So I know a lot of people are like, oh, we eat our veggies and like all they eat are broccoli, right? But we want to make sure we're getting all the colors. So often I give out checklists, and it's like, you make sure every week you get through all your colors. That's a fun way to kind of incorporate that into your day. And the other kind of little like easy tip is like kind of get, if you're looking at quantity, what are we usually looking for? 9 cups. And I tell this to everyone I talk to pretty much. And you're talking 3 cups of your colorfuls. That's like your reds, yellows, oranges, and then 3 cups of greens, and then 3 cups of white, brown. So those are your onions and mushrooms and garlic and cauliflower and whatnot, because they all kind of have their individual benefits. So try to incorporate all those things into your diet, and it would be awesome. The other thing about nutrition is there are, as much as food is good for you, there are foods that are bad for you. So we want to limit our inflammatory foods as much as possible. Inflammatory foods would be things such as like deep fried foods, processed sugars, fast food, those kinds of things. Those have like scientifically shown to increase your inflammatory markers in your system. So if you're trying to stay healthy, you don't want to introduce these foods. My general rule is kind of like, that 70-30 rule. You 70% eat healthy, and then 30%, you have to, you want to binge or indulge sometimes, go for it. Assuming you don't have an underlying condition. If you do have, like many of the people I work with have a little bit more of a compromised immune system, it's like, it's zero. It's none of that food, the inflammatory foods, as your body is trying to heal, because you don't want to like kind of drive that inflammation in the body. Another thing just I want to touch on is the digestive system, because 70% of your immune system is located in your gut. So you want to think about that. Are you having any digestive issues? Do you have regular bowel movements every day? And as naturopaths, we talk about our gut all the time. So we actually, you know, you want 1 to 2 bowel movements that are solid formed, kind of look like bananas. That's what my daughter tells me all the time. She's like, oh, I have a banana stool. So, you know, we want to make sure that's what it looks like. And if it doesn't look like that, there's certain things, like if it's on the drier side, it could be dehydration. If you're on the looser diarrhea side, it could indicate there's like an overgrowth of some sort of bacteria. So that's kind of where you want to evaluate if that's working properly, because that can be a reflection of an immune kind of imbalance. And so when we talk about gut, a lot of people ask about probiotics. So probiotics is a very big topic, and there is research showing that there are beneficial like bacteria in the gut that are anti-inflammatory, immune supportive, and there are ones that overgrow and cause a lot of problems. The thing is, do you go out and buy a probiotic and just take any random one? I don't usually advise that, simply because we don't know, without knowing what's going on in your digestive system, you could actually aggravate things. So like some like shelf brand strain could feed into like a bacteria that is overgrowing in your system that you don't want to overgrow. So sometimes like we like to evaluate that, and it's hard to know without like doing a stool analysis to figure out what's going on. So I recommend, usually if you want to introduce like good microflora into your body, like you need to eat vegetables. That's like definitely been shown, like the vegetables and the fibers and all of that in it is going to feed a good flora, and that will boost your immune system without, you know, trying to introduce a supplement that way. The other thing is using like fermented foods, so sauerkraut, kimchi, and those types of things could be beneficial. And lastly, some of the supplements that are generally very good for the immune system that are widely available, but like I would still recommend you talk to your healthcare practitioner, because they aren't without side effects sometimes, right? Like you want to make sure it's safe for you and doesn't interact with anything you're taking, and so that you're taking it in safe amounts. Vitamin C, that is really, really beneficial. So as Julie mentioned, I do IV therapy, and a lot of times like we're putting like very large doses of vitamin C into those IVs in order to kind of give that immune boost. So orally, you can take it in moderation, like small over-the-counter doses, to just kind of keep your levels good. Vitamin C is something we don't actually produce in our body. But most animals do. Somehow we kind of evolutionized and don't do it anymore. And it's produced in response to oxidative stress. So when you're ill, your body is stressed. And the vitamin C comes in and it kind of cleans up all that, like the reactive oxygen species is what it's called. Those are the things that cause inflammation and damage to your tissue and cells. So the vitamin C comes and sweeps it all up along with some other nutrients, but it's super important to keep inflammation down and keep you healthy. So they work alongside vitamin A, vitamin D, and zinc all together as a very robust immune response. So those are just the kind of main micronutrients I like to turn to for immune support in terms of preventative, right? So vitamin D is one of those things you want to get tested. Most of us in North America are low, but you want to check your levels, because if you're low, you might want to kind of up that, because it has been shown to be very immune protective. So that's one thing that you can maybe consult your healthcare practitioner about and get that checked out, because prevention is kind of what we want to do, right? We don't want to get sick, and we don't want to end up having to go to the doctor or to the hospital or anything like that. So these are all things we can do easily from home and relieve the burden on the healthcare system.
Great. Yeah. Thank you. That's so helpful. And with the vitamin D, like I test that all the time. I don't know like I end up testing that with a lot of my patients, and I would say, especially if there's chronic illness. How often would you say? I mean, for me, I guess the percentage, I'm curious, like what kind of percentage would you be looking at in folks with chronic infection of folks with like lower vitamin D status? Oh, you're muted. Pardon me. Go on. That was a question. Go ahead. You should wait, hold on. You're still muted.
Mute.
There you
Okay,
go.
can you hear me now?
Yeah.
I rarely see anyone with sufficient levels.
Okay, yes. So more than 50% are
More
insufficient.
than 50.
I
Yep.
would say, yeah, the majority as well in my practice.
And a lot of them may even already be supplementing.
Mm, yeah. And so with supplementation, they may still also be low. Yeah. And that's a really good point with regard to the form of vitamins and when to take them and how to take them. I mean, it being a fat soluble vitamin, but like we said, and like you mentioned so aptly, uh, this is really where individualization is really important, and making sure that we're testing first, and get a good diagnosis before you start investing into this stuff. I mean, it can be not costly, and you might think, hey, it's not a big deal. Vitamin C was cheap this week. Vitamin D was cheap this week. I got it at Costco, but there are side effects, to your point, Dr. Kwan. So I really appreciate you mentioning that. Let's open it up for questions afterwards. But I think the next big topic that we've been asked a lot about is herbs. So I'm going to ask Dr. Tabar to start. There we go. And I'm going to unmute her. So thanks, Dr. Kwan. Okay, Dr. Tanya Tabar, you are off mute. So do you want to, can we hear you?
Yeah, thanks, Dr. Julie. So I'll be talking about herbal support for staying healthy. Just to reiterate, please see a healthcare provider if you want or need to take herbs. This is especially important if you're on medications or have a health condition. Herbs are generally very safe, but you want to work with someone who is trained and who can individualize them for you, because there are interactions and there are contraindications with herbs. So just a heads up with that. So I'll be talking about herbs that support the immune system and herbs that support stress and anxiety. In regards to the immune system, the herbs I decided to focus on are those that support what is called deep immunity, so your long-term immunity. And these are herbs that work on making us more resilient and protecting us in the long term. So I'll talk about a couple of those. So the first one is Astragalus. Astragalus is a root. Before I go into that, all herbs have multiple actions and properties. So that's one of the ways to choose herbs when working with someone. So I'm going to mention some of their immune stuff, but I also might mention some of their additional properties. So Astragalus increases healthy immune function. It increases white blood cells, and these are cells that are used to deal with infections and what your body deems as foreign. And it also promotes tissue healing activity. So you can imagine that it would be good to take if you're trying to stay healthy. It's not something you would take if you are sick, but if you're in that in between when you're trying to build your immune system, that's when you would take it. So the part used is the root, and one of the ways that I like to use it personally is by adding the root when I'm making a broth or stews, and it's also in the change of season soup, and you'll be getting recipes for a bone broth and for the change of season soup in the handout that we'll be sending out next week. So caution with Astragalus, and also that the flavor is quite bland, so it won't actually impact what you're making. And just caution with Astragalus is any medications or conditions that increase white blood cells. So that caution means this is avoid, do not take this herb, talk to your healthcare provider, red flag. So caution with any conditions or medications that increase white blood cells. Other ways I like to support the immune system are with medicinal mushrooms. One of my favorites is reishi. And reishi supports, again, the long-term immune system. It's antiviral, it's antihistamine, and it also raises our T cell counts, which is an important part of its antiviral activity. Reishi, it's not great to eat, but it's generally used more as a tincture. Yeah.
It's kind of gross.
Yeah, it is gross.
Yeah.
And there are pretty good mushrooms to eat: shiitake, maitake, oyster, and those are also good for the immune system, for the deep immune system. I also want to talk about licorice. Licorice is immunomodulating. So this means that it responds to what your immune system needs at that time. So this is the nice thing about herbs, is sometimes they know what to do in your body depending on what your body needs at that time. So that's what immunomodulating means, is that herbs can either activate, they can boost, or they can restore your normal immune function depending on where you're at that time in your life. So this is what licorice does, which is why it is such an important herb. It is also an antiviral, and it moistens tissues. So that includes like lungs, the digestive tract, and this is one of the reasons I use it for dry cough, chronic digestive conditions, and it's tasty. It's sweet. I mean, it's tasty for some people. I like it. It tastes like licorice.
Yeah, it makes everything better.
Yeah, exactly. Because often other herbs are very bitter or earthy tasting, so it's a nice touch. Important caution: licorice and blood pressure, high blood pressure. These should not be used with anyone who has or suspects high blood pressure. So those are the herbs that support, again, our deep immune system. Generally, this is when you are not sick. This is when you're working on staying healthy, and when you want to build that resilience. So I thought, okay, what other category of herbs should I talk about? And during times of transition, it's important to support stress and feelings of anxiety. So there are two categories of herbs that can be helpful with stress and anxiety, and those are nervines and adaptogens. So let's start with nervines. So nervines are herbs that nourish our nervous system. In other words, they tone and strengthen our nervous system, and therefore support people experiencing anxiety. So what patients will often describe this feeling to me after taking nervines: oh, I feel like it took the edge off things. I feel like improved sleep, or everything just felt a little bit easier to deal with. And one of my favorite herbs in this category, maybe this is my top 10, or one of my top 10s, is oats or oat straw. Latin name is Avena sativa. And it's very gentle. Doesn't mean it's not effective. It's gentle and effective. And it's a nerve tonic, so it tonifies the nervous system. It's good for acute and chronic anxiety. And it's nice as a tea or tincture. And while some herbs have a sedative effect and they're more in the relaxing nervine category, like passion flower or skullcap, oats does not do that. It won't make you feel tired if you take it in larger doses, which can happen with some other herbs. So it's more of a nourishing herb, and that's why I really like it. Another herb that is a great nervine is lemon balm, Latin name Melissa officinalis. It's very supportive with sleep It helps elevate mood, and it's also an antiviral. I like to use this herb when I see the digestive connection to stress, because it does support people who hold stress in their stomachs or digestive tract. Caution with this herb is anyone who has a thyroid condition. And
so hypothyroidism,
that's right.
well, underactive thyroid.
So the last category of herbs, which is in the category of supporting stress, are adaptogens. And adaptogens are herbs that help us cope with physical and mental stress. And so you can imagine that these are herbs that are great to take during times of transition. This is actually how they're meant to be taken. They're meant to be taken shorter term while coping with a stressful situation. And they do this by impacting how our adrenals respond to stress. So I also hear when I give patients adaptogens, I also hear that sentence again, which is, oh, it really helped me respond to things in a different way. Like I didn't feel as reactive or as responsive, even though my level of stress may have not changed. So that's why I love adaptogens. A couple I will share are withania and, or ashwagandha, same herb, different names, helps with energy, supportive for hypothyroid, so underactive thyroid, and it's also an anti-inflammatory. Another herb that is a great adaptogen is Eleutherococcus, and that's Siberian Ginseng. Siberian Ginseng supports with stress. Again, it's an adaptogen. It helps with focus, mental clarity. So it's good for folks who might not be able to focus because their minds are overactive. And I use this to support patients in preventing burnout if they're pushing too hard at that time. And a caution with that herb is overstimulation in people who don't need it. So this could look like headaches or just feeling agitated. And I just want to mention with the adaptogens, they're used generally best to be used for shorter term stressful periods to help you cope with that stress while you're working on changing your lifestyle or changing working on your general coping strategies. And those are some of my favorite herbs.
Thanks so much, Dr. Tabar. It's so helpful. I mean, I think we all know that when we get really stressed out or we overwork, we end, the second we slow down, and maybe other folks have experienced this around this time, but when we slow down for a minute, that's when we get sick. and when that tends to happen, that can be so much linked to what's going on in the immune system, and the stress can have such an impact on depreciating our resiliency and our ability to boost our immune system. So I really appreciate you sharing these herbs. And I know a lot of people have been asking us, like, what should I be taking? What should I be taking? And just to reiterate, like, it is super important that you consult someone like Dr. Tabar or any, naturopathic doctors are at least trained in herbal interactions and herbal prescribing. But anyone that's trained in herbs, because a lot of times it's very complicated because they have such broad phytochemical spectrums within the herb that there are actually multiple different ways it can interact with different medications. So at least there's a resource here, and we're trying our best to put all the references into this handout that we are going to be sending out. And so again, if you have questions at the end very soon, then we'll also try to include everything we can in what we're sending out. I think that the more information we all have, the better. And and a lot of people, I think, right now might be experiencing a little elevated stress from a particular situation that might be going on. And so, you know, really these are such great tools to assist with that. I wanted to give a couple of lifestyle tips before we wrap up and start taking questions. And I also wanted to put out a little poll. But some lifestyle tips that we will put in the handout are, but I wanted to mention are stress management. I mean, it came up a few times, both for you, Dr. Kwan, and for you, Dr. Tabar, on how we can manage stress on a day-to-day. And so some techniques, you know, meditation, breathing techniques, diaphragmatic breathing I use a lot. What else comes to mind? For me, exercise is something I prescribe and encourage for all of my patients. I really recommend exercising 5 to 6 times a week. And if you need an at-home exercise right now, I often recommend the 7-minute workout because there's so many resources on it. You can put on a really good playlist. It's just like 3 songs. And I just printed out the exercises and then you go through the circuit. You know, it's really simple and it's all body weight stuff. So a 7-minute workout might be something that some of you might be able to do right now. You know, do either of you have any other exercises that you tend to go to? Okay, so maybe we can talk about that another time. And yeah, so exercise is really important. And then stress management, we'll probably have a psychotherapist, one of our psychotherapists in our group will share some visualization or meditation techniques in the future. But that is something, you know, that can obviously have a huge impact on your physical health. Some freebies. So I just wanted to mention a few things. We're gonna, again, do this handout and we're gonna email out the link, so look out for that. I also wanted to refer to a blog that we wrote last year on how to stay healthy and keep your immune system up. So I'll send a link to that, but it is on our aurummedicine.ca blog. So aurumedicine.ca/blog. It's there. But we'll send out a link as well. We have a video on on a talk that we did for the Women's Healthy Environments Network, Dr. Tabar and I, on your health and the environment on our website. And you can also sign up for a Spring Cleaning Wellness Challenge. And what I'm going to do shortly is, so there's Spring Cleaning Wellness Challenges on our website. And then what I'm going to do now is really open up the group chat for anyone who has questions, and we're going to do our darndest to answer them. Again, we can't give medical advice online, as you probably know, but please, you know, feel free to, in the chat box, the Zoom group chat, type in your questions. Let's see if we can answer them. And then I'm going to send out a poll right now. I'm going to launch the poll as well while we do that. And you can all pick sort of which topics you might want our clinical team of health providers to address for you next. So we have a poll in progress, and we also have the group chat available. So if you want to jump on the poll or send us a question in the group chat, then we'd be happy to answer that now. I'm gonna oh great, so we've got some requests coming in. Okay, so we have a question from Natalie. I don't know if you can see them. Can you see them, Tanya, Dr. Tanya?
Yeah.
Okay, so what are some foods that are high in fiber that you would like to recommend? So that's the question. Any recommendations? Maybe Vivian? See, you're excited.
High in fiber.
Yeah.
All vegetables, I would say. are very high in fiber, especially the greens. The leafy greens have a lot of fiber in them. I particularly, if you, like you're looking to add fiber into your diet, I actually like to make it's like a paleo keto friendly bread that I use psyllium husk in it. So that's
Oh,
an
nice.
Nice.
really good fiber that you can add into your diet. What else? Nuts and seeds.
Yeah. I use a lot of seeds in my recommendations, as long as they're not allergic to seeds. Um, but I also recommend breaking down the fiber into different kinds of fiber. There's like soluble and insoluble fiber, and so being able to balance those two. And then, yeah, exactly, Rebecca. So I was just going to say legumes are a great source. Beans and legumes are a great source of fiber. Tanya, do you have any?
I think like Dr. Kwan said, once you get those vegetables and that well-balanced diet in, you really it's you'll kind of see things moving well. So I
Great point. Yeah.
usually start there.
One point about adding fiber into your diet is you want to make sure you increase your water consumption.
Yes.
Fiber can help move your bowels. It pulls water, right? And it bulks things. So if you don't have enough water, it can kind of have the other opposite effect and cause some.
Yeah, that's a great point.
Yeah, it is.
And actually, to your point about probiotics, which you had mentioned, what's great about fiber-rich foods is they have a high prebiotic content, and so like that's where the legumes are really strong. The like artichokes, like those kinds of foods. Does that answer your question, Natalie? I think that's a lot of fiber rich food. Okay, great. Great. Natalie says yes. Any other questions? Please feel free. Okay, Michelle, I'm going to actually unmute you, Michelle.
Hi.
Yeah, if you want to ask your question, go ahead.
Yeah, so pardon my voice. I'm still recovering from whatever this bug that I've got is. I've heard that soil-based organisms are the best probiotics to look for. So what does that mean, and what do you folks think about it as naturopathic doctors?
So you mean in terms of a supplement?
Yeah, I think so. Like I've heard it come up or like read about it in like random blogs and stuff, but I've never seen it talked about by like a naturopath in particular. So I want to know what they mean by soil-based organisms, like soil-based versus what are the other options, I guess. And like how is that what you would recommend, or like how, like I mean, I know it's you can't give medical advice, but I'm just curious about what it means, like soil-based organisms, and I don't know.
So when you talk about soil-based organisms, I think like in history when we're like talking about the immune system and how it developed and how like we used to be dirty, like eat things that grow on the ground and like they're living in the soil, right? And you by default you're exposed to that type of those types of organisms, and that has historically been protective, right, for the gut and for the health. And with modernization and sterilization and everything so clean, we don't have those anymore. So I think they're trying to reproduce that kind of diversity that you have been exposed to, say, if you lived on a farm or if you like lived in the wild. But unfortunately, I don't know, like it's hard to say because like our soils have changed, right? So we even get that anymore. And also everybody's gut is different. So that's kind of where I hesitate to ever prescribe a probiotic without knowing what it's for. I tend to go for probiotic therapy. So if I know there's an overgrowth of something, I will give a certain strain of probiotic to fight that off. More so than just trying like all the kind of new fads of, you know, we have the soil-based, we have the spore-based, we have all those other, I don't know, whatever's out there these days. Keepers and, you know, those types of things. And it may be right and it may not be, and it's kind of, sometimes it's trial and error, right? But
Mhm.
yeah, that's kind of just why I hesitate to just give any probiotic.
Gotcha.
Yeah, I mean, to your point, I think, you know, a lot of folks may not know this, but we can have access to GI testing, which includes stool testing. And when we can see the actual balance of the bacteria, then you know, what Dr. Kwan's saying is that she can be extremely specific. And it actually might save you some money. So, yeah, if you're, you know, buying, like, I mean, a lot of times I think Saccharomyces boulardii is included in as a soil base one. And like, you know, sometimes it's given singularly, you know, and sometimes it's given in compound with others. So, you know, in order to get the most, probiotics ain't cheap, like as far as the supplements go on the spectrum, they're probably on the more costly end. And so, yeah, I don't know. Does that answer your question though?
Yeah, kind of. I mean, I guess like where I can't remember where exactly it's been a few months for sure since I was reading about it. And like I just randomly came across it. You know, you see these like doctors in the US that are like, buy all my products, and like it's like their whole like marketing thing, but they're a doctor. So I saw a lot of it like in that realm, and I was kind of like, oh, like I don't know, just like feeling kind of cautious, but also it piqued my curiosity. And yeah, like just in terms of like seeking out a probiotic and like I mean, I think these people have like a vested interest in what they're selling, but yeah, like just like is there a difference between like the usual probiotics? And one of the things that was mentioned was that you don't have to refrigerate them, unlike the other like I don't know. Anyway,
Well, I
other
don't know if you were on the call for this, but when Dr. Kwan was speaking, she was talking about how she doesn't often recommend a probiotic. So maybe
okay.
that's something you can talk about. You know, like I'm sure you guys can talk about it offline, but or you can check the webinar. But that's really what she was talking about is how
Okay.
we tend
Yeah,
not
I
to
missed the first
prescribe
one.
right away. Yeah, okay, that makes sense.
Yeah.
But great question. I mean, obviously, you know, asked and answered, you know, hopefully we can get you an answer that's suitable.
Yeah.
Other folks? Okay, I
Thank
think
you.
Lisa has a question, so I'm gonna, thanks, Michelle. Okay, so unmute. Yeah, Lisa, why don't you go ahead? You can speak. You're unmuted.
Hi, can you hear me?
Yes.
Hi, I was trying to message, but it wouldn't let me for some reason. I was just asking about high inflammatory foods and what to avoid.
Yeah.
Highly inflammatory food. So as a general, for everybody, like white processed sugar, high fructose corn syrup, those are like kind of two key ones. Deep fried foods, processed
Dry?
like takeout foods, and trans fats, those are all like very pro-inflammatory. What else? If you want to kind of like extend a little bit, like the top kind of inflammatory foods that generally people become sensitive to in the kind of sensitivity world, would be gluten, dairy, soy, sugar. Yeah. Do you have any other ones you would add to that?
Eggs.
Well, I mean, in terms of like volume, like those probably have the biggest inflammatory bang for buck.
Yeah.
I often talk about the fats too, like the
trans
polysaturates. Yeah, like so omegas. Like a lot of people talk about omega-3 rich foods. What we're really inflammation wise, if you have we usually talk about like the inflammatory pathway and how if you have an omega-6 to 3 ratio that's too higher than I think the recommended one. Vivian, you know, you can correct me if I'm wrong. I believe it's 5 to 1 omega-6 to omega-3 ratio is ideal. And that's why so many folks eat omega-3 rich foods. Lisa, I don't know if this is what you're thinking of, but having a sufficient omega-3 content in the diet to come up and match the omega-6 so that it's more like 1-to-5 ratio as opposed to maybe like much higher omega-6, which is common in the standard North American diet. What that's been shown to do is reduce the prostaglandin production and move the body down a less inflammatory pathway. So I often recommend really foods that are high in omega-3s, but not cooked, because a lot of the fats research show that if it's any polyunsaturated fatty acid is cooked, it will tend to change in its quality and then could also be inflammatory. So I hope does that answer your question, Lisa? Give you some ideas?
Yeah, what about Nightshade?
Yeah, so Alex asked, or I don't know if that's Alex, but A. Collins asked about nightshades. Someone want to address that?
I deal with nightshades based on a per patient. So it depends on if they have an inflammatory condition to start with. And then I work with them to see if they respond to nightshades by eliminating them and then reintroducing them, because I also recognize that it's hard to cut out a lot of foods and maintain a healthy diet. So I think it's important to balance how much food you're restricting to what is doable for you. So my approach with nightshades is doing a 1-by-1 elimination and then reintroduction.
Oh, wow. Cool.
Yeah. Sometimes when you are sensitive to foods, it's an indication that like something is imbalanced, right? So yeah, sometimes you have to eliminate things and like let your system have a rest and reset, but it's important to figure out what's going on. Like, why have you developed so much inflammation to these types of food, right? And taking it out for a certain period of time may be necessary. And then like Tanya said, it's an individual cases and circumstances, right? So what works for someone may be different for someone else. But yeah, they tend to be categorized into a more inflammatory food sometimes if you're sensitive.
Yeah, and I think my approach, just to add on to that, is that I usually go based on the condition. So if someone is presenting with, I see a lot of folks with migraines and skin conditions, so eczema being one that's particularly inflammatory. From the environmental medicine perspective, we tend to look at inflammatory or things in the diet that could be adding to inflammation, and we see the whole body as like a barrel, and the analogy is there's a hole in the bottom of the barrel. And just from an environmental medicine perspective, the idea is that if you're loading up this barrel with water and then with oil and toxicants, at a certain point in time, the rate of adding to the barrel is going to exceed the draining capacity of the hole at the bottom of the barrel. And so what happens is you might get overflow. And so that's kind of how I see inflammatory foods a lot of times, especially in these conditions where you're sort of the overflow being the symptoms, it could be inflammatory rash, other kind of inflammatory type symptoms. And so what we like to do is really increase the diameter of that hole at the bottom of the barrel to increase the rate of emptying. And that's through the gut health and the liver detoxification pathways. But also when you're talking about decreasing inflammatory foods, it's a really good point, because we want to decrease the amount that we're adding to the top of the barrel. So, if you can't eliminate all dairy, does it help to eliminate quite a bit? Yes. But to Dr. Kwan's point about the development of sensitivities, food sensitivities, which we could talk about ad nauseum, that there could be an underlying cause that in terms of something deeper that might be creating the foundation or contributing to the foundation of that developing, that hyperreactivity, hypersensitivity reactions, things like that. So I guess that's a long-winded way of saying like it really depends on the person. as well. But I do hope you feel like we're really trying to answer your question. Does that help? Does that help, Lisa? And
yeah.
Collins. Okay, great. Thank you so much. Are there any other questions for the chat? Angie, thank you so much. Any other questions for the chat? I'm really grateful that many of you filled out the poll. So it looks like home acupressure treatments might be a thing. We're talking 100% of people want to hear about that. So maybe we'll have to get our Aurum acupuncturist online and do a little session about that. But we'll try to create more content moving forward. I hope you found today helpful. Again, we are recording this. This is live on Facebook as well right now. And I'm gonna suggest that we end the call. Thank you guys so much for being here in the middle of the day. It's our pleasure, really, Angie. This has been super fun. And I want to let you know, we've got a lot of things going on. So just follow us if you want to keep in touch. And Dr. Kwane, Dr. Tabara, and myself, we're naturopathic doctors, and we all have 15-minute discovery calls. So if you have questions about your individual condition, don't hesitate, because I think that a good relationship with any provider involves, just making sure it's a good fit for you. So I encourage everyone who's looking for more work on themselves right now, take advantage of those free 15-minute calls to assess for fit. And why not, right? We're trying to make sure that everyone has access to what they need, and really it is helpful to to get everything sorted out in advance, so that you can really tailor your diet and your lifestyle to what it is you want to accomplish. So we have those available virtually as well. And then we also have a psychotherapist and a team, and they all have 15-minute free consults as well. So don't hesitate to reach out if you have questions, and we're going to do our best to do everything we can that's not considered medical advice to support you guys. Or, if you do become our patients, then we'd be happy to help as well. Our Instagram handles are at Aurum Medicine, AURUM Medicine. And then we have individual ones that are all, I think, doctor, first name, last name for each of us. Is that right? So Dr. Julie Huang, Dr. Vivian Kwan, and Dr. Tanya Tabar. So easy. We'll be in touch. Take care. Stay strong. You're all doing great. And thank you so much again. Take care, everyone.